Greetings, my name is Daniel Torres. I'm a certified personal trainer from the Los Angeles area, and today I'm going to share a video with you of exercises that have been very successful in helping my clients overcome back discomfort and prevent back pain. Now, if you're currently a back pain patient, you've had surgery, you've had any kind of chronic pain in your low back, please consult your physician before actually doing the exercises. Today we're going to focus on your quadratus lumborum, your external obliques, and your internal obliques. Now, these three muscles bridge your pelvis to your ribs. And if this area is very strong, your spine is going to be very stable. Now you want your spine to be stable during movements such as gait, running, jogging, getting in and out of your car, brushing your teeth, daily movements of life. The idea here is to get strong, remember. So we're going to start with very easy exercises, stretches on the floor, and then progress them to load-bearing exercises on your feet. The idea here is to work in different planes and do about 3 sets of each exercise. We're going to work for 15 reps, and you're going to have to select a load that is appropriate to stress you throughout that 15 reps. If you get to the 15th rep and it's too easy, get a heavier load, 5 pounds up. Still too easy, 5 pounds more. You got to feel for it. If you can stay within your technique and it's not challenging on your last rep, get a heavier load. The idea again is to get strong. Strong backs don't get nearly as injured as weaker backs do. All the stretches in the world are not going to help you if your back isn't strong. That's how you're going to manage stress throughout daily life. If you have any questions at all with the video, please feel free to email me at dtorres101@hotmail.com. Thank you and hope you enjoy. One important thing to note through this routine is the activation of our transverse abdominis. Now, during most exercise, we have a tendency to distend. This creates intra-abdominal pressure, but we're going to ask you to draw in to create the same kind of pressure and the same foundation from which to exert force. Now, we're going to activate a horizontal muscle that wraps around all the way to our lumbar spine. This transverse abdominis muscle, when engaged, keeps your spine nice and stable. So during all the exercises on this routine, suck your abs in. The first exercise we're going to focus on is lying on our back with our palms up. Not palms down, rather palms up. Bring your feet off the ground, keep your knees and feet close together, and rotate from left over to the right. The idea is to keep your shoulders down and your head looking straight up the whole time. To progress this, you extend your legs a little bit longer and continue to rotate from side to side. Now on this one, we're going to reach one arm toward the opposite leg. So in this case, left toward the right and right toward the left. Please note that you bring your head up every time your arm comes up. This one's more of a stretch. You bring your leg as high as you can, and then you assist with the arms to pull it in the rest of the way. This is to help stretch out your hamstrings and low back. A squat, rotate, and reach exercise also helps loosen you up, and you have to make sure you keep your head and your chest up the whole time. You don't want to be hunched over on this exercise like this. Got to keep your chest up, bend your knees, rotate, and reach. To make it a little harder, grab a medicine ball, pull it in toward your chest, extend, touch the bench, into your chest, extend, keeping our head and chest up the whole time. Now on this one, we're going to tilt down to the side and we're going to push straight overhead. What we don't want to do is push over to the side. You have to keep your feet close together, tilt down, and push straight up. Again, feet close, tilt down, and straight up. So another tilting exercise, you keep your head in between your arms as you move from side to side. Don't let your arm collapse onto your head. Keep your head in the middle and continue to move from left to right equaling 1 rep. On this one, we have a load in one arm and we tilt again from right to left. You don't want to hold a load in each hand and do a little teeter-totter. It's going to defeat our purpose. Hold a weight in one hand, tilt down to one side and over to the other. We're trying to work your quadratus lumborum and your obliques. This quadratus lumborum here in the low back is a hip elevator, but can sometimes be an aggravator to the back. We want to make that back nice and stable. Now this is a squat extension rotation exercise. You have to keep in a very erect posture. You're going to stand up and you're going to rotate, bringing the weight over your shoulder. Now you have to keep your feet very close together to minimize stress on the knees. And the tendency here is to hunch forward, and what we have to do is keep our head up, our eyes looking straight ahead, and we have to keep our chest up too. Now extend the arms, but don't let the weight tug you down. Again, staying very erect, feet close, stand up, and throw the weight over your shoulder. You have to do this 15 reps on either side. Don't let the weight pull you forward onto your toes either. You got to keep your weight back, more on your heels, flat-footed, stand up, and rotate. Use 10 pounds on that one, make it light. Now this one, we have our hips right at the edge of an inverted bench. We grip underneath, and we don't want to be draped on the bench, head down, shoulders down. Your shoulders back, head up, not your chin up, chin down, but keep some space between your head and the bench. Now your legs are very stiff at the back, toes are tapping on the ground. You're going to bring them up and apart, together and down, up and apart. 15 reps on this one as well. Now these are some exercises that we do not want to do. This is a lat pull with a neutral grip, and now this is a lat pull with a wide grip. You often see people using a T-bar row in the gym like this. Now all these exercises we want to omit from our routine. We're going to exclude this overhand pull-up, this underhand pull-up, as well as the neutral grip pull-up. Again, all these exercises you're going to omit from your routine for the first 4 to 6 weeks. Here's another exercise that falls into the same category. It's a sagittal row with a neutral grip. Instead of this hand position, we're going to ask you to use a T-bar so you can use the overhand wide grip. This is going to emphasize the upper back now. So we're going to pull it in just below our chest on a straight line, keeping your elbow and your wrist on one plane. Now the tendency during this exercise is when you pull in and you get to the very back end, is to let your elbows drop down to your side. You got to keep them up. Sometimes it'll want to bend at the wrist, but you have to keep them up to do it right. Keep your shoulders out of your neck, keep them down, keep your elbows level, extend and pull and hit yourself right below your chest. Continuing with the upper back, this is overhand grip, reverse pec deck. Now what you don't want to do is have your shoulders into your neck like this. Rather, you want to keep them out, have a long neck, and try and throw your arms back, pinching your shoulder blades together. If this is difficult, try an underhand grip. Put your palms up, grip, and throw it back, trying to keep the elbows bent the whole time. And now the final exercise is a bent reverse fly with dumbbells. You're going to get your head down in alignment with the rest of your spine and throw your hands back. The idea here is to throw your hands back. We're going to always emphasize this so as to help your external rotators. We want to make sure the hands get back, not the elbows, because when you push those elbows back, it brings your shoulders into your neck. We want to keep them out and try and get a little external rotation. If you were standing tall, it would look like this. Well, that concludes our back exercises for today. Remember to do 3 sets, remember to do 15 reps, and left to right movement equals 1 rep. You have to hold your belly button sucked in, and you have to keep your back erect during all exercises. Do it for 4 to 6 weeks, and send me all your success stories. My email address is dtorres101@hotmail.com.